Okay, good evening. Welcome to our medical billing and coding live Q&A. It's been a while since we did the last one. It's been several months. Time flies by, and it's been several months. But there are a lot of individuals who are getting started in their medical billing and coding journey, and we wanted to come on and answer any questions that you guys have. We were once, in your positions, newbies, just getting started, so we're happy to answer any questions or concerns that you guys have. I guess we'll start out by briefly introducing ourselves and then get into the chat. So let's see. Go ahead, Natasha.
Okay, good evening, everyone. Thank you so much for joining Kiana and myself. We are doing the medical billing and coding Q&A on this evening. So I am Natasha C. Miller, also known as the medical mompreneur, and I've been in healthcare now for over 23 years. Really excited about that. A little bit about myself before we get started. I originally thought I was going to go be a nurse. I was taking all those prerequisites but decided to stay behind the scenes. And that was one of the best decisions that I've ever made. And so, one of the things that I do in this industry is I help women and moms and men now to prepare for the CPC exam. So, we offer the CPC exam review, and we also provide medical billing services as well as consulting and training services. And so, that's just a little bit about me, and I'm gonna pass it over to my sister, Miss Kiana Craig, Miss Axtabiller.
Thank you, Natasha. My name is Kiana Craig. As I just put in the chat, I am located in New York. I've been working in the healthcare industry since 1999. I started out as an emergency room registrar and worked my way up into different roles, different settings. I've worked in hospitals, private practices. I'll just fast forward to 2006. I started working for a private practice, an OBGYN group, and I was the liaison between the practice and the billing company. And long story short, the billing company started to make mistakes. I took advantage of that without any prior medical billing experience. I took advantage of that and I went to the providers and asked them if they would give me an opportunity to take over the billing. And they said yes. They gave me my first opportunity. They became my first client way back then. They're actually still my client to this day. So that just goes to show the longevity in this career that you can have. So I became a AAPC, a licensed AAPC instructor in 2020, and I have an online medical billing course that I teach as well as assist my students get certified, get their CPB credential. So again, we wanted to come on tonight and answer any questions that you guys have. So feel free, say hello in the chat. Let us know where you're tuning in from. Feel free to leave any questions that you have. We have some frequently asked questions, that we brought as well that we'll go over in the meantime. Okay, so I guess let's start with the basics. What is medical billing and coding? And I'll let Natasha go first because medical coding takes place first.
Yes, medical coding takes place first. So even though you do hear medical billing, it's actually the coding that takes place first. And coding is the provider actually transcribing their information into written codes, right? And so it can be numeric codes or alphanumeric codes. That information gets translated so that way it can get over to the biller to be able to bill off the claims. But as a coder, we help the providers in their documentation far as once they have documented what was done for the patient, we help them in translating those codes into those alphanumeric codes or numeric codes. And so that can be the CPT code, for example, ICD-10 CM code, as well as your HIPAA codes. And so we are needed as coders. So if you're thinking about getting into this industry, please do so. There are so many opportunities available to you. But in a small nutshell, that is what a coder is. We are helping with those codes and making sure we are coding accurately, right? And specifically for what has the patient has come in for. Now, Kiana is going to share what is medical billing.
Yes, so after the coding is done, medical billing can take place. So the coders are providing us with the codes, or maybe the providers. The providers are coding their encounters as well. So they'll complete a super bill, they'll provide us with the codes, and that's what we're going to use to create the claims. So, and even prior to then, before services are rendered, we should be doing our due diligence. We should be contacting the insurance payers, verifying eligibility, right? First and foremost, eligibility, making sure that the coverage is active, and verifying the specific benefit for the service that is going to be rendered. So we're going to find out specifically, and if you have codes, that's even better. Provide the insurance payer with the codes to verify the service that is going to be rendered. And then once you have the benefits, you can relay that to both the patient and the provider. So everyone is aware of the coverage. Everyone is aware what, the expected reimbursement and patient responsibility will be, because there are never any guarantees, even with in-network claims. Even when the provider participates and accepts the insurance, there are never any guarantees. So we're going to verify the benefits, verify eligibility. The service will take place. The provider will supply us, or the coder will supply us with the codes. We will create clean claims, which are claims that are free of errors. We'll submit them to the insurance company. If all goes well, it'll go through that process called adjudication, and they'll process the claims based on the patient's benefits and issue an EOB and hopefully a payment. And once we get the payment, we can post the payment into the billing software. And if there's any remaining patient responsibility that wasn't collected up front, preferably, but if there's any remaining patient responsibility at that time, we can send them a statement and collect their balance. So in a nutshell, that's medical billing. Of course, there are a lot of different things that can take place throughout the various cycles, the various stages rather of the revenue cycle. So, being educated and trained is extremely important, and it's going to help you to be a very knowledgeable medical biller. So anyone can become a medical biller or a medical coder, as long as you're willing to invest the time and the energy and put in the work to learning. It's really an industry that is it's great, and it's available to anyone. Let's see if we have any questions in the chat.
I do see some questions coming in. I love it. Um, and before we do that, just talking about also being a medical coder, it's really important that you are someone who loves and likes to pay attention to detail, right? Because we are looking at the documentation, we are helping those providers with clarifying the diagnosis, for example, or coding out those surgeries, those office visits, all of that. There's a lot of guidelines that comes into place with medical coding, and making sure you understand when to use the codes, when not to use them. So if you are someone that likes to read, pays attention to detail, you don't mind working independently, possibly from home, you don't have to be around a lot of people, then a medical coding could be something really good for you, because you have to be able to work on your own, but then also be able to work with the team, as well. So just wanted to share that too. All right. You want to start with some questions? I see some questions coming in.
Okay, so let's see here. Someone says I have two questions. Is medical billing a lucrative career, and is it constantly in demand? So yes, I can attest to that. Medical billing is a very lucrative career. Of course, there are different stages. You can start out as being an employee and working in various different settings. You can work in an office, a clinic, a pharmacy, a hospital, so many different settings. I mean, even insurance companies you can work for. You can work for medical billing software companies. You can work for the clearinghouse. There's so many different areas that you can work in, but obviously you can start out as an employee and get the experience that you need. You may possibly decide to move on and become a freelance medical biller, which is great because that provides a lot of flexibility, a lot of time flexibility, a lot of location flexibility. You also get to, decide what your compensation will be. So that's also great. That's how you're able to make more. You may decide to start a medical billing business, which is great. I started my virtual medical billing business in 2008, and I'm still here and doing great. So, yes, it's very lucrative. It's always in demand. There are providers everywhere. You don't have to just work for providers in your local area. So let's say you're working or living rather in an area that doesn't have a lot of providers, or that's a rural area. That doesn't mean that you're not going to be successful. That doesn't mean you're not going to find an opportunity, because you can reach out to providers and work for them really in any state. So social media is a great tool that you can use to, market your services, to reach out to providers. A lot of different ways you can do that, but I would definitely take advantage of social media. Let's see. How much medical coding billing experience do you suggest having before one starts their own business? That's hard to say. I think it depends on the individual. So I can't just say that, after having 1 year of experience or 2 years of experience, you're going to be ready to start your own business. It really depends on the individual. You really do have to have an entrepreneurial mindset in order to start a business. It is a lot of responsibility. So, that definitely varies. Someone says, can you get carpal tunnel from medical billing? Well, I'm sure you can. Medical billers are working on computers all day. I know for the last, I'm losing count now, since 1990, I started medical billing in 2006. So since 2006, I've been doing medical billing every day, full time, whether it was as an employee or as, a business owner. I haven't personally suffered from carpal tunnel, but I'm sure a lot of people who, have this type of position and they're typing all day using their hands, maybe, that may be a possibility. Natasha, you want to take the next one? She says, does being CPC certified, does being CPC certified make it easier when billing?
Great question. So I'll show our question. Does being CPC certified make it easier when billing? Not necessarily. So having your CPB and CPC does make you more marketable, I would say, especially if you are trying to either get a job as a biller and a coder, or find clients and you're able to offer the services to both, right? But billing and coding are two different things. And so it's not so much about it making it easier. I mean, you will have the knowledge and the information to do both tasks, but you may not want to do that depending where you're working, right? In the organization you're working for. So you really need to decide, is that something that you want to do? Do you want to have both certifications? Also be mindful that you have to pay for the CEUs to the APC when you do have more than one certification. But you can have just one, for example, the CPC, and do really well with just that.
Let's see. Let's look at the next question. Have you done any federal contracts or subcontract work yet? I personally have not. I have set up my business. It is certified. It's a woman-owned small business. It is certified to be able to accept contracts. I just personally have not pursued those opportunities yet. But if you're, thinking about starting your own business, that is a way of finding clients, and there are opportunities out there. You can get federal contracts, you can get state contracts. I know, medical billing business owners who who currently even have those contracts. So it is a possibility. It's just not something that I've pursued.
And I can help answer that too. So I don't have any federal contracts. However, I do have contracts. I get I guess you can call them private contracts with consulting firms, with different health insurance companies. So they don't have to just be federal. And then also, even for example, with consulting firms, you can come in as a subcontractor as well. So there's a lot of different opportunities for contracts. If that is something that you want to do, just make sure you do have, your business in order, all of the necessary documents to be able to do that. And yes, it's very lucrative, I will say, as well.
Let's see here. Someone asked, if you buy Biller Bootcamp, how long can I take to study it? So for those of you who are unaware of what it is, Biller Boss Bootcamp is actually my signature course. It includes access to a medical billing and software training, as well as the AAPC CPB, or Certified Professional Biller prep course, the books, the membership, and the exam. So you are given 6 months access when you enroll to the CPB prep course, which is sufficient time for you to practice, to study and practice and prepare for the exam. I do give a one-time courtesy extension if you do need it, but you really want to stick with your goal, stick with a specific schedule, stay focused. I know things happen, we have families and things going on, but try to stay focused and get it done within that time frame. You really don't want to prolong it. Even after completing the course, you don't want to prolong the exam. I know a lot of individuals are so intimidated by actually taking the exam, but with Biller Boss Bootcamp in particular, I do give my students, I purchased the voucher with 2 attempts. So you do get 2 attempts. So, we're going to think positive and hope that all goes well and you pass on the first attempt. But if you don't, you will have a second attempt. So after you complete the course, you really don't want to prolong scheduling the exam. You want to take the practice exams. As long as you're passing those over an 80%, you should really go ahead and get a date on the calendar, schedule the exam. But, again, to answer your question, if you do need a one-time courtesy extension, I'm happy to do that. But you're given 6 months access to the prep course once you enroll. You have 1 year access to the actual hands-on billing and software training course that teaches you the day-to-day responsibilities of a medical biller. Let's see. The next question, do you check insurance and coverage prior to the patient's appointment with the physician? So yes, that is one of the responsibilities that I do have or have had in the past. Every provider, every office, every facility, I can't say that they necessarily do it, but it is, it's one of those things, best practices that you definitely should do. You don't want to have any surprises as far as coverage being terminated or the patient not having coverage for a specific service that is going to be rendered. Just because the patient has insurance doesn't mean everything is covered. Some plans are very limited and others, are a little bit more extensive. But yes, you should definitely be verifying eligibility and benefits prior to rendering services. Even the softwares have the capability of at least checking eligibility. I mean, that's the bare minimum that you should do. Make sure that, the policy is active prior to every visit. Okay, let's go to the next question. Can credentialing also be a great niche in medical that provides lots of money? I can't confirm about lots of money. That all depends. You are going to determine how successful your business is. Okay, so that all depends on the individual. There are plenty of opportunities, but you have to put in the work and get the clients and the opportunities and put yourselves out there. But yes, credentialing is a niche. Credentialing is a service that you can offer, a standalone service, or in addition to managing the revenue cycle. Natasha, I think you should take the next one.
Okay, I'll take the next one. Let's see if I can get it to click. There we go. Hello, everyone just tuning in. Do you have to be certified to code? Yes, you do. Sweet and to the point, right? Yes, you actually do not need to be certified to be a biller, but as a coder, yes, you have to be certified because you can be held responsible if you code out something that's incorrectly, if you are sending out or coding, fraudulently coding out services. So we do a lot as it pertains to guidelines and understanding what to code, what not to code, making sure we're not unbundling codes and so forth. So that's why it's very important that you are certified. And I always will recommend the CPC through the AAPC. That's the gold standard, especially if you do not have any prior experience. So.
I see several of my students, but one of them, Shona, hi Shona, she says in the comment, great course with a lot of detailed information. It really is a great course. It's great not only for beginners, you don't need any prior healthcare experience, billing experience, to be successful, to pass the course, to get certified. It's a great course, and the Biller Boss Bootcamp includes 2 courses. So it's the AAPC CPB prep course and my billing and software training course. And I do find that, it is great. I get a lot of good feedback about it because it is great for beginners, but also for those who maybe have experience, haven't done billing in a while, and want like a thorough refresher. Because we do go through all of, the responsibilities. It will help you to master the fundamentals of medical billing. There are a lot of recordings and materials in the course, so that you do get that hands-on training, so that you're ready for real-world medical billing. It's not just the education piece, which is extremely important. You will get formal education by preparing for certification and getting certified, but you also need that other piece, which is the actual hands-on training on how to do the day-to-day responsibilities. And you'll learn a software as well. Let's see. Does working as a medical biller without certification make the training exam process easier? I'm a little confused by that question. Does working as a medical biller without certification make it easier? I'm not sure what you mean by that, Pinkish. So,
So like maybe
Mhm.
I'm not sure, the individual is probably saying if they already have medical billing experience and they go to take the exam, maybe without studying for the exam, is that easier? Um, Maybe you can rephrase it, but just to answer that question based off of how I am understanding it. So no, you actually do need to go through a program. So one thing about the certification exams, they are meant to either study for them, go through a program. They are not meant to just say, okay, today I'm going to wake up and take the exam. You have to actually go and study and be prepared for the exam. So I would highly recommend to take Kiana's Miss Axe the Biller's Biller Bootcamp course. She will help you to be successful in passing that CPB exam. Um, so hopefully that answers your question.
Thank you. T says, if we have questions during Biller Boss Bootcamp, who can we turn to for answers? Me, your medical billing instructor. I'm a licensed AAPC approved instructor. So me, you'll reach out to me. I'm accessible to my students. Like I said, several of them are here. If you guys could chime in the chat, I'm accessible all the time. And we do meet live. So the prep course is pre-recorded and self-paced, as well as the billing and software training is pre-recorded and self-paced, so that you can learn and study when it's convenient for you. But we do meet live once a week, every Wednesday at 8 p.m. Eastern Standard Time. We meet live on Zoom, and I'm available to answer any questions that you have. Are there study guides? Yes. So once you enroll in the prep course, this is for CPC and CPB. When you enroll in the prep course, you are given a textbook that's included with the online prep course. I know for my boot camp, I also include one free practice exam, and there is a study guide. I don't necessarily recommend it if you're in the course, only because all the information in the study guide is in your textbook. So if you're not enrolled in the prep course, then I would definitely recommend purchasing the study guide along with the practice exams to prepare for the exam. But if you're enrolled in the prep course, I don't think you need to, spend the additional money on the study guide. I think you have all the information you need in the prep course and in the textbook. So Bree says, I wish I could combine the two courses. So you can do CPB and CPC. You actually can. Now you don't have to do them both at the same time. That's a little bit challenging, but you definitely can. I took the CPB exam first. A couple years later, I went ahead and took the CPC exam. So you definitely can. So Michelle says Biller Bootcamp includes medical coding. No, it does not include the CPC, right? So you're not going to be learning coding per se, but you will get an intro to medical coding class that is taught by Natasha Miller. Natasha Miller joins us and she teaches intro to coding. Now, again, it's not teaching you how to code, but you're learning about the code sets, right? The CPT, the ICD-10-CM, the HCPCS. She does a great review for us. We practice answering multiple choice coding questions because on the billing exam, there are 135 multiple choice questions, but 10 out of 135, so it's a small fraction, but 10 out of 135 of those multiple choice questions are coding questions. So you will need those coding manuals to answer those questions. Natasha, you want to take the next one?
Yes. When it comes to taking a course with the APC for coding, do you recommend an instructor led course or self paced learning? I have no experience at all. Great question. So, I would actually recommend an instructor led course. I am actually an instructor led instructor, a virtual instructor led instructor through the AAPC. So you may be actually in one of my courses, but that is what I would recommend. Self-paced is great, but the instructor-led courses, you do meet weekly for the live sessions, and we cover the important concepts for the exam, and then you also have 1 hour every week for office hours. Self-paced, you're just on your own. You have no one to converse back and forth with. So I would recommend an instructor-led course. And then after that, I will recommend my CPC exam review. I do have one being offered every month. And so we'll talk more about that once we wrap up. But you definitely also want to do an exam review to help you to make sure you fully prepared to passing that CPC exam.
So the next question, I read that you can command a higher salary when certified. Is this always true? I guess it all depends. It all depends. There's so many factors, so many different factors that go into salary. It depends on geographic area, it depends on the position. Of course, certification, your experience, the specialty. There's so many varying factors, but I do believe the more you earn, or the more you learn, rather, the more you learn, the more you can earn. I definitely believe that the more you can command, and if it's not a possibility, if you're working maybe in a particular place and maybe you've reached the ceiling, maybe you've reached the cap, you can always look for opportunities, elsewhere. Honestly, but I think it depends. But certification can definitely help, and AAPC certification, in particular, can definitely help. I just, I don't want to say that it's a guarantee necessarily in every situation. I think there are a lot of varying factors.
Right. And I'll just add to that really quick. The AAPC has a salary calculator on their website. And so that can help you to get an idea of how much you should be earning, making in your area and based off of your certifications that you have. So I would recommend to check that out because that's really helpful, especially if you are trying to figure out if the job opportunity is even paying you within a certain range that it should be. You can use that as a reference point.
Okay, Pinkish, I think what you were saying, thank you for clarifying. If you have medical billing experience, is going to help you with your training and maybe make it a little bit easier to get certified. It's definitely going to help, right? It's definitely going to help if you have experience. You'll probably have some knowledge and a lot of the material that is covered in the prep course, and that will be on the exam. But it's not an easy exam. I don't want people to think because they have experience, it'll kind of be a breeze. It'll be easy. There is a lot of information that is covered. So I guess we can talk about the best ways to prepare for the certification exam, the prep course, because the individuals that create the prep course and create the practice exams, those are the individuals who are creating the actual exam. So the prep course is a great way to prepare for the exam. Of course, the textbook that is included, you want to study that textbook, cover to cover. If you're not enrolled in the course, you can purchase a study guide. That's a great resource as well. And then the practice exam questions are going to mimic the questions that are on the exam. Are they going to be exact, word for word? No, obviously not, but they will be similar. So I know for CPB, for the billing exam, there are 3 practice exams available. They are 50 multiple choice questions each. You can take them as many times as you want. You should be taking them, continuously over and over for various reasons. For accuracy, you want to continue to get better. You want to be timing yourself. You want to pace yourself because the exam is 4 hours. So 4 hours, 135 multiple choice questions. You have 1.70 minutes per question. So you want to time yourself. And what was I going to say about the practice exams? So there are 3 practice exams available that you definitely want to use to prepare. Once you're scoring over an 80% on the practice exams, it is a good indication that you're ready to go ahead and sit for the exams. And then review classes. Review classes are a great way as well to prepare. Once you have your exam date, try to schedule those review classes close, to your exam date. I offer review classes for the CPB exam. As a matter of fact, I'm offering a free it's a mini one. It's only 1 hour, but I'm offering a free mini CPB review class this Friday, March 31st from 12 to 1 p.m. You can get the registered for the Zoom link on my website, justaskthebiller.com. And then Natasha mentioned she also offers CPC review classes every month. So it is a great way to review right before the exam. What is the importance of compliance in medical billing, and how do you ensure that billing practices meet legal and ethical standards? Once we are certified by the AAPC, there are definitely ethical standards that we agree to adhere to. You want to definitely have certain protocols in place, abiding by HIPAA, protecting PHI. You definitely want to have things in place. Some things that I do are pretty simple but effective. So, like my work computer, I'm the only one that works on my work computer. No one else has access to it. I put a what is it called? A screensaver that goes on pretty quickly after 20 or 30 seconds of it not being used. I don't share PHI obviously with anyone, family, friends, via email, anything like that. With my providers, when we're communicating, we use HIPAA compliant things like what do I use? Google Drive. We use shared drives to communicate and to share documents and spreadsheets and things like that. I've used, I'm trying to think of a couple other platforms, Dropbox, um, things like that. So you want to make sure that you have certain things in place so that you're staying compliant and definitely protecting HIPAA. Is there anything I didn't mention, Natasha, that maybe?
No, you did a great job. And then also, I use a VPN, which is called a virtual private network. So just depending on who you're working for, they may provide that for you, or if you in business for yourself, you may need to provide that for your business, just to make sure that all the information is secured, right? Also, if you are in business and you're helping the providers, maybe you are doing audits. So that's a way to help make sure that compliance is correct, and looking at the claims and looking at the documentation. So there's a lot of different things that you can do as a biller or even as a coder like myself to help those providers and making sure that the practices are staying and being within the legal ramifications and ethical, right? Because we want to make sure that there's no fraud, there's no abuse. And so audits are a way to do that.
After completing the Biller Bootcamp, do you help with job placement? I do not help with job placement. That's not my area of expertise. But ways that you can find opportunities, number one, you can find them online on employment websites, Indeed, ZipRecruiter, Monster, Craigslist, still LinkedIn. Definitely, you can network on LinkedIn. AAPC has a job board, and register with healthcare staffing agencies because they will assist you find employment. You know, if you're going to be a W-2 employee, they will assist you find employment at no charge to you because that is something that is covered by the employer. They pay their fee. So definitely register with healthcare staffing agencies, and they will contact you when opportunities become available. Oh, and then definitely you can network, with your local APC chapter.
Yes, I was going to add to that the networking with the local AAPC chapters. And also, the AAPC has what's called the internships. They have internships available to you after you do become certified. Maybe may or may not be in your area, but that is something you're able to check out. And that's a way for you to get employment and possibly be able to start sooner than later. So check that out as well.
Can a patient relations job be a good start to do billing? I think so. I would love to see the job description, but I think so. Definitely, you have to be comfortable speaking with patients. You definitely have to be good at communicating, right? So, before I talked about verifying eligibility and benefits, you have to be able to communicate that information to the patient so that they understand it because, they don't, even though it's their responsibility to understand the plan that they have, but it's always, a nice added benefit for the biller to be able to explain the benefits to the patients in a way that they understand. And when they understand, they're more likely to pay their statements. Does the billing coaching group offer a study guide? There is no study guide with the billing coaching group. That's the hands-on billing and software training. The study guide is for the certification, the CPB credential or CPC. What software or tools are commonly used in medical billing? So medical billing, we're going to be using medical billing softwares. One of the most frequently asked questions I get about medical billing software is which one they should purchase, or should they purchase software, which one should they purchase, what do I recommend? I have always used my clients softwares, whatever softwares they have. They would give me access to it. Most of them, I believe all of them with the exception of one, have been cloud-based, and most softwares now are cloud-based, so they can easily provide you with a username and a password, and you'll be able to log in and access the software from anywhere in the world, which is why we're able to work remotely, because you just need high speed secure internet access, and you'll be able to log into the softwares. So if you're working with a provider who has server based software, so let's say they purchased the software, downloaded it to their server computer in the office, you can just remotely log into the computer. And I've had maybe one or two clients where that was the case, and we can easily log into the office computer. That's not a problem. But most, again, are cloud based. Most will give you a username and a password, and you can log in from anywhere. Okay, I think that's all the questions. So, Natasha, I guess we can kind of wrap up the chat and talk about what we have going on maybe in the next 30 days and what services we offer.
Yes, I love it. So, in the next 30 days, we have our CPC exam review. and that will be on April the 29th, 8 a.m. Pacific Standard Time, 11 a.m. Eastern Standard Time. It is virtual through Zoom, so you can join from anywhere all over the world. And it's a 4 hour CPC exam review. A lot of information shared, and then we do 50 test questions, practice test questions to get you ready for the exam. So you can find that on our website, ncmhealthcare.com, and we'll put the information in the chat. And then also, we do have practice tests available. If you just want something digitally right now to prepare, you can find that information on our website too.
Yeah, so what I have going on in particular this week, let's see. So Friday, I mentioned that on Friday, this Friday, March 31st, from 12 to 1 p.m. for 1 hour, I'm hosting a mini CPB review class. So it's only 1 hour. My review classes are normally 4.5 to 5 hours long, and review classes are normally that long, if not longer. And sometimes they have two parts because you're getting a lot of information. But I'm just hosting a mini review to share what to expect on the exam format. We'll go over some practice exam questions. We'll go over some case studies. It's going to be a quick mini review. It is AAPC approved for one CEU, and all are welcome. You don't have to be enrolled in a course. You don't have to be scheduled for the exam. Maybe you're curious about what to expect before you enroll in the boot camp. So all are welcome. Maybe you just want to get the CEU, because once we're credentialed, we have to maintain our credential by paying our annual dues and by earning CEUs, which are continuing education units. So maybe you need one CEU, and that's perfectly fine as well. So you can, again, register that on my website, justaskthebiller.com. And let's see. So Thursday, March 30th is Medical Billers Day. That's, it's a great way to end the first quarter. It's a great way to celebrate medical billers and, what we do every day to help patients and providers and keep the revenue cycle going. So in honor of Medical Billers Day, I'm actually having a sale. So if you're on my email list, I did send out some emails, but I am having a sale. You don't need any discount code. You'll see a big sale, or big discount rather, automatically deducted at checkout. So it's going to be $330 off from March 30, 330. So that will automatically be taken off at the checkout screen. So that's on this Thursday, March 30th. And again, Biller Boss Bootcamp, if you're looking to get certified and trained, or just the billing coaching group if you want to get that hands-on training so that you can become a knowledgeable medical biller. So Natasha, did you share your contact information?
Let me share it because I'll share it so everyone can see it here. I put it in the group, but I'm not sure if it's showing up. So NCM, I'll share it, and then what else was I going to share really quick? I think that's it. So yes, we have a CPC exam review. So if you are taking your CPC exam in May or June, you want to register for our next CPC exam review, which will be April 29th. You do not want to miss it.
Yeah, and follow us on Instagram. My Instagram handle is Ask the Biller, and Natasha's is Medical Mompreneur. And we thank you guys so much for your time. Feel free to reach out to us if you have any further questions. And we honestly wish you guys the best in your careers, in your businesses. It's not easy. Like I said, we know where some of you are at if you're just getting started. No question is a stupid question, honestly. It's expected that you're going to have a lot of questions and concerns when you're just getting started, but definitely utilize us and our resources that we have available to assist you guys, get into this industry or just get, to the next level. So thank you guys so much and have a great night.
Thank you, everyone.